Good afternoon. For today, I will be performing to you the skills in assessing the breast and axilla. For the preparation phase, first is to assemble the equipments to be used, which is the centimeter ruler. Then for the procedure, introduce yourself and verify the client's identity. Explain to the client what you are going to do, why it is necessary, and how the client can cooperate. Good afternoon, ma'am. I am Julian Nestor Bacay and I will be your student nurse for today. I will be assessing your breast and axilla, and it is necessary in order for us to determine the abnormalities in your breast and as well as with your axilla. Then, next is to perform hand hygiene and observe other infection control procedures. Assuming that I have already washed my hands, and I will sanitize it with an alcohol. The next step is to provide client for privacy. You can provide the client privacy by closing the door and the curtains. The next is to inquire if the client has any history of the following, such as breast masses and what was done about them, any pain or tenderness in the breast and relation to the woman's menstrual cycle. Then, any discharge from the nipple, medication history, estrogen replacement therapy, mother's history with breast cancer, alcohol consumption, high-fat diet, obesity, menarche before age 12, menopause after age 55, pregnancy after age 30, and breast self-examination, technique used and when performed in relation to the menstrual cycle. Then, before proceeding to the assessment, explain to the client kung why it is needed to remove the lab gown of our client. And you can explain it by saying that it is needed in order for the assessment to be done correctly. And then after undressing the client, you can now inspect the breast size, symmetry, and contour or shape while the client is in sitting position. Then after that, you can also inspect the skin of the breast for localized discolorations or hyperpigmentation, retraction or dimpling, localized hypervascular areas, swelling or edema. Then after that is to emphasize any retraction by having the client raise the arms above the head, push the hands together with elbows flexed, and press the hands down on the hips. So as you can see, my improvised client has no hands, which is my mannequin. So I'll be demonstrating it to you. Raise the arms above the head, or push the hands together with the elbows flexed, and press the hands down on the hips. Inspect the areola area for size, shape, symmetry, color, surface, characteristics, and any masses or lesions. Inspect the nipples for size, shape, position, color, discharge, and lesions. Then after inspecting, you can now palpate the axillary, subclavicular, and supraclavicular lymph nodes. The client is seated with her arms abducted and supported on the nurse forearm. Imagine na lang na merong kamay yung patient and nakapatong yung kamay niya sa aking forearm. Then, after that is use the flat surfaces of all fingertips to palpate the four areas of the axilla. The edge of the greater pectoral muscle along the anterior axillary line, the thoracic wall in the mid-axillary area, the upper part of the humerus, and the anterior edge of the latissimus dorsi muscle along the posterior axillary line. So, you can palpate it starting from the axillary area of the patient. Then after that is to palpate the breast for masses, tenderness, and any discharge from the nipples. Then palpate the areola and the nipple for masses. I will be palpating the areola and the nipple for masses and also the breast for masses by using the, kasi there are ways to palpate the breast, which we have the wedge and also the circular type of examination, and I will be using the circular type of examination. Then after palpation, there are no masses or tenderness in the client's breast, and you can also do that with the other side of the breast. Then compress each nipple to determine with the presence of any discharge. So assuming na may nipple yung mannequin, so i-compress natin siya. Ganun. Then, if discharge is present, milk the breast along its radius to identify the discharge producing lobe. Assess any discharge for amount, color, consistency, and odor. Note any tenderness on palpation. So, as I compress the nipple of my client, there were no milk from the breast that came out, so there are no any discharge in the client's breast. The next is to teach the client a technique for breast self-examination. Then, before document findings in the client record, dress the client. Then after dressing the client, you can now document findings in the client's record.